So a rhinoplasty is a safe operation, but as with every operation, there are risks. I guess one of the important risk is that the patient may not like the result. That's not really a complication per se, but it's an unfavorable result. But this is where experience again comes through in a proper discussion and proper consultation, where we give a pretty good idea to the patient what they're gonna get. It's always good to under-promise and over-deliver. That's the secret of success when it comes to any kind of surgery. Now, when it comes to actual complications, early complications would be a nosebleed or a small infection, but this shouldn't really worry you too much. I've actually had, in my career, I had 2 nosebleeds over 15 years and over 4,000 rhinoplasties that I've done. So that's really low. In later in longer term, the most common problem that I get in my hands as a rhinoplasty is one also that you cannot really predict or do a lot about it, and that's what you call callus formation. So basically, when you break the bone heals by forming new bones. So sometimes you can develop a little secondary bump up here. And the chance of that happening is about 5-10%, and I would say about 5% of people that have a rhinoplasty will need a little corrective surgery to sort this out. It's actually a very simple solution, a very quick treatment. It maybe takes 5 minutes to sand it down, and that's actually most of the revisions that I do. What other problems can you get? That can be usually a bit of scar tissue forming, and especially if somebody's got thick skin, it can appear like the nose is maybe a little bit bulky sometimes, or it can distort the symmetry sometimes. Scar tissue, there are a few things you can do about it. You can inject it with some steroids, or sometimes you can correct it a little bit. Generally speaking, the corrective operation in my hands is between 5 and 8%. In courses, some of the most famous kind of plastic surgeons in the world, or they used to be anyway, they used to quote a revision rate of between 10 and 20%. So I think my revision rate is pretty good compared to that. And generally my revisions don't tend to be would very rarely have to do a big job. It's mostly touch-ups. One of the important things that we need to understand about the rhinoplasty is that the nose is primarily for breathing. It is for looks. People come to me for looks mostly, but a lot of people come for a combination of looks and breathing. So the problem with rhinoplasty is that most of the times you actually make the nose smaller. So if you think about it, making the nose smaller means that the airway is smaller. You cannot really have a smaller nose with a bigger airway. But that is what we're trying to do. And somehow we've kind of figured out a way of doing it. So there are ways that we do that all the time, that we can make a smaller airway more efficient. Now, if you think about it, if you just do a purely cosmetic rhinoplasty, most of the people will come back and say, I cannot breathe so well. What does that mean? You can snore, or you can have problems when you sleep. It's usually when you sleep that you get problems breathing. So you can breathe from your mouth, or when you go for a run, you breathe from your mouth again. And that is really why we don't do purely rhinoplasties anymore, and we do a septorhinoplasty. So the chance of worse breathing after a normal rhinoplasty would be over 50%, but the chance of worse breathing after a septorhinoplasty, which is what we do, is under 10%. And actually 30% of people have a smaller nose, but they can actually breathe better, which is kind of a miracle if you think about it.